remember the moment when this was going to be serious because I realized I was not going to be celebrating my birthday. That was the day we declared a public health and a local emergency because we saw already as one of the communities that were taking folks from Wuhan, China in our military camps and serving them of what was coming. And we knew then and there, memorable from a birthday, but memorable from the public health local emergency declaration, that this was going to be something that we have never seen before and something that was going to require the whole mobilization of our county. Emotional trauma that the pandemic has done, the trauma of individuals who've lost loved ones, mothers and fathers and young children and grandparents. And that brings sorrow, but that brings emotional trauma because in some cases people couldn't have a human touch if they were in a skilled nursing facility where they were being cared to and loved by the nurses and doctors, but the family couldn't be there for them. Those are long-lasting scars. When we deal as the safety net, whether it's protecting children or protecting seniors or feeding the insecure or dealing with mental health issues or dealing with people with access without care, it's always been a portion of the population. The COVID chaos impacted the entire community. What was different here is that we had to be thinking about the well-being of the entire county population. It wasn't good enough to protect some. We had to protect all. And this clearly was a new challenge for all of us. Visionary leaders are seeing what everyone else is seeing, but doing what no one else is doing, often at the cost of mockery by the present for the betterment of the future. We had some mockery lane as we were going through that event and saying, well, you're overreacting. But what stuck with me was that we were looking at the data, at the science, and we knew we had to get ahead of this to protect our community. And that will always be something I cherish about what we've done as a community. But what I want them to know is how, not just me, but the thousands of public servants and our frontline clinicians and put others before themselves in every day since this fight of the pandemic. And I want to be known as someone that really put our community first and the best interests of our community always first in mind. It gives me immense hope that our generations to come, who will be stronger as a result of today, will make us, San Diego, California, and this country, a better place than we even hold today. And I'm extraordinarily excited about that because I think that is something that will guide the well-being of this nation way into the future. And COVID, in some respects, has brought us even together stronger. It has put more spotlights on the health inequities of our region that were already there, but even further compounded as a result of the pandemic of COVID-19. What we say in San Diego is that we can only live well when we all live well. And I think what this will do for us in the future is double down, triple down our work to ensure that we will never be overrun again by another pandemic of sorts. It has brought our communities together as a whole, where we're going to work on to become even stronger as a nation into the future.